There's no facet of our daily lives that aren't impacted by internet connectivity and reliable broadband access. Now,
Mhm.
unfortunately, where I live in the district that I represent is in an area that doesn't have access reliably to broadband right now. And, like many other rural areas of Texas, a significant percentage, probably north of a quarter of the residents at least, have trouble accessing broadband. And I think statewide we have several million households that don't have access to broadband. So it's really an issue. It's critical right now. It's underscored probably more than ever for educational purposes, both public and higher education at those levels. Obviously, commerce, just running a business, folks shopping and needing access to goods and services through the internet is as important as it's ever been, and probably relied on more than it's ever been at this point in our history. I think training, job training, very important, and just access to information, and healthcare. I don't want to forget healthcare, because telemedicine, access to telehealth, especially in rural communities where access is limited, even in good times without a pandemic, it is so important. So these are challenges for us. There's just no part of our daily existence that isn't impacted one way, shape, or form. And so even in areas like Amarillo, which is, as I mentioned, a fairly densely populated community, there's pockets of Potter County that does not have reliable internet access. And so I'm a big advocate of seeing that we expand access, not just in District 87, but across the entire state of Texas. It is as important to us as it's ever been. You'd have to live, under a rock to not understand how important that access is and how much we've really grown to rely on it, in such a significant way. I mean, I know, individuals who are ordering their groceries, via an access to the internet, and getting their prescription drugs, and just, everything that you can think of. So yeah, I think it's a little more urgent now. And even outside of this, when we get on the other side of this pandemic, maybe one of the silver linings, and there aren't many, but maybe one of them will be that everybody sort of regards this as such a necessity now, that maybe didn't before. And for those that have had it and enjoyed it, and really have taken it for granted, just like turning on a tap and getting water, or turning on your light switch and having light, just relying on this broadband access in a reliable way is something that many folks still don't have. And just having a choice of providers, for instance, in some areas too, is a big issue. So I'm totally convinced that the urgency level has increased. People do understand that they are every day more and more going to rely on it, and maybe the way we do business on the other side of COVID-19 will have changed things too, to rely, to make folks more more reliant on this for their business, their training, their shopping, just the way they conduct their lives. So yeah, I think the urgency is probably heightened a little bit, but I also think the understanding for the need is also greater as well, which is going to be good when we go back into session here in a few months, so that more people will be engaged on the issue. Maybe even if they live in a densely populated, totally accessible part of the state. I think the issue will make total sense to everybody in a much different way, with a different perspective. I mean, I am so excited about the opportunities for the expansion of broadband access, for the implementation of more telemedicine uses. It's a great medium through which telepsychiatry and mental and behavioral health connections, treatments, counseling, diagnoses can be made. It's great in the physical health world too, for a whole host of issues and a whole range of treatment options and diagnosis as well. And it's great for those of us that live in an area where you may have to travel 45 minutes to an hour to go see a clinician or a doctor, But if you're in Houston, Texas, or Austin, Texas, the traffic there is awful, and if you just have to go
Mhm.
across town, that could take you 45 minutes to an hour as well. So having the ability to access your doctor and have your doctor be able to treat you that way is great for everybody. And I think the more folks that get used to receiving and providing their treatments that way, or their visits that way, the better off we're going to be. And I do think it's an area that is uniquely positioned to see a lot of progress and advancements made here in the next few years. One thing that we did last session in Texas was allow some rural hospitals the ability to use telemedicine to maintain a level 4 trauma designation. And just seeing that in practice and seeing how those connections to trauma practitioners, even in other parts of the country, and how it's utilized and how it's very effective, was fantastic. And it's being used for NICUs, and it's being used for just regular doctor's visits. And I think the possibilities and opportunities are quite large. The governor's broadband development council should come out with some recommendations here before the end of the calendar year. I know others are advocating for things like a permanent office, state office for broadband expansion. We need more of a plan. We need better mapping. We need some foundational things to happen so that we can really put these wheels into motion at a faster pace. And I think it would be good for the country. It'd be very good for the state of Texas, but it's ultimately going to be where we need to end up. And we can get there, over time, and probably less expensively, or maybe in a rush when things are more expensive, the way this dynamic tends to work out. So I'm hopeful that we keep the wheels turning and make continued progress towards expanded access.